Greetings. My name is Dr. Waddell Brooks, Sr., your host, and this is Community Focus. Ladies and gentlemen, we have an outstanding guest in the studio with us this morning. She is a person that you should know. We're talking with Dr. McKee Conner, nephrologist. She's with the Nephrology Associates of Northern Illinois and Indiana. An office is located in Gurnee, Illinois. Good morning, Dr. Conner.
Good morning.
We're very happy that you've literally taken time from your busy schedule to be with us this morning to let Lake County know all there is to know about nephrology. And of course, I will be learning right along with my audience. By the way, Lake County is approximately 850,000 people. But I don't know how many up this Sunday morning at 5 a.m. listen to the program, but I understand we have a pretty good audience. First of all, I'd like for you to tell our listening audience a little bit about your personal and professional background.
Sure. It's a pleasure to be here. Thank you for inviting me. I grew up in Illinois, grew up in actually the western suburbs, and then have been living in Lake County for about 14 years now, and I've been in practice here for 13 years. I went to Loyola University, then I went to medical school, which is Chicago Osteopathic, then went to, did a residency at Christ Hospital in internal medicine. After that, did a nephrology fellowship in New York, and then relocated back to the area where my family is, and have been in practice here since then in Lake County. And I work out of the local hospitals, which is the Vista Community Hospital and Condell Medical Center. Our group also goes to Cancer Treatment Centers of America. We have multiple clinics. I have lucky to have 5 other partners who help with the practice and are wonderful people to work with. We have multiple locations for our clinics, where my primary clinic is in Gurnee. My 2 other partners see patients there. We also have clinic in Grays Lake and Vernon Hills. We serve as medical directors for various dialysis units in the community. I serve as the medical director at Fresenius Kidney Care in Waukegan Harbor, which is on West Street, and also the Fresenius Kidney Care in Gurnee. It's a privilege to be working in this community.
Dr. Conner, what piqued your interest in the science of nephrology and renal medicine?
I think it's because I was a chemistry major, and nephrology deals with a lot of electrolytes and acid base, and it's a very mathematical science with nephrology. So, and I find nephrology to be, involving multiple organs and a complex specialty. And so that's what first piqued my interest.
What do kidneys do? That's part of your training.
So kidneys are a very complex organ. They do so many things. They filter blood. They remove waste products. They remove salt and water from the body. They control the fluid balance. They regulate your blood pressure. They regulate multiple electrolytes. A lot of these things are processed within the tubules of the kidney. There's other hormones that the kidneys help make, such as a hormone that helps with anemia. It also hormones that help regulate bones. So many things.
Wow. In nephrology, there's a board certification, and why does a board certification matter?
Well, the initial board certification, validates your training, validates that you've completed all of the rigors of your training. You have good knowledge of your training,
Mm-hmm.
and so and a nephrology board certification is, tells you that you've completed your training well,
Mm-hmm. Mm-hmm.
and of course after that it's up to the nephrologist to keep continue to learn, and as things come up, to keep up with the training, which which
Mm-hmm.
only helps you become better, take care of your patients better.
Ladies and gentlemen, again, we're talking with Dr. McKee Conner,
That's correct.
nephrologist, um, associates of Northern Illinois and Indiana. And she's going to tell us that what exactly does a nephrologist do?
So we help patients who have any type of kidney disease.
Okay.
They could have patients who have diabetes, patients who have high blood pressure, sometimes develop kidney disease. Kidney disease is a chronic condition
Okay.
that often you can only tell by urine tests and blood tests. So sometimes your doctor may check your blood tests, your internist or your primary care doctor, and certain numbers in the blood may be elevated, such as blood urea nitrogen or creatinine. When those values are abnormal, often the patients are referred to a nephrologist to assess further. The nephrologist can also help with various other electrolyte disorders, low potassium, high potassium, sodium alterations. Nephrologists, we also assist with managing blood pressure. Difficult to control blood pressure can sometimes be related to an underlying kidney disease. Nephrologists also help patients with kidney stones, kidney infections, other types of genetic kidney disorders. There are multiple other diseases such as lupus or immune-mediated diseases that can affect kidneys. So we help assist the primary care doctor, the general internist, in evaluating that and determining a cause for why the kidney function is not normal. What can be done about this? Can the kidney function be restored back to normal? Certain drugs, certain medications can be toxic to the kidneys, and taken long term can affect kidney function. So we help assist with all of that, help figure out what can be done to improve the kidney function.
So early detection is important.
Absolutely, absolutely. Early detection in terms of controlling your blood pressure, controlling your blood sugar. Diabetes and high blood pressure are the two leading causes of having chronic kidney disease. So if your blood pressure and blood glucose are controlled, then there's less chances that you would develop kidney disease. Certain medications, if you're not aware and you're taking them, such as ibuprofen, Motrin, those types of medications taken long term can cause kidney damage.
So I assume that dieting is, well, I shouldn't say dieting, but the foods that you eat and so forth, if they're not controlled, then you're subject to develop kidney disease more than others, right?
I would say that's accurate, because if you're obese, obesity often leads to high blood pressure. Obesity leads to diabetes. So if you don't maintain a healthy weight, then you are more prone to other diseases, which then can cause kidney disease.
I know my mother was in her 80s before she developed the kidney disease and had to go on dialysis.
Oh,
80 years
okay.
old,
Wow. Okay.
So it could happen in later life too.
Yes, absolutely. We're we have so many. Patients are people are living a lot longer now. We have the and so oftentimes some of these diseases can continue to affect us, and as we progress in our age, you can then develop, worsening kidney disease.
Dr. Conner, does it happen more in men than women, or is that a factor?
No, I would say not so much more in a gender, but there are certain ethnic groups that tend to have higher incidence of kidney disease. Oftentimes, those are linked with obesity at times, but not so much gender based as much.
So actually, the doctor, your family doctor, and we encourage everyone to get a family doctor. That family doctor is the key then, through his testing, to find out whether you have a problem with the kidneys or not. Right?
Absolutely, and the thing to always remember is, always checking with your doctor, especially if you have diabetes or high blood pressure, and asking your doctor, how are my kidneys doing? Are my kidney blood tests okay? Making sure that the urine doesn't have blood or protein, which are abnormal findings in a urine analysis. Asking your primary care doctor, what's my creatinine, which is the marker for kidney disease. And normal levels are usually less than 1 in the blood. And if they're higher, then that's a signal that perhaps the kidneys are not functioning well. Now, that could be just a temporary thing, but it could be something that's been ongoing and may need to be looked at. But your primary care doctor would be able to advise you.
So it's highly recommended that you keep your kidneys healthy as long as possible, right?
Absolutely. And, people do donate kidneys.
Okay.
So we're usually born with 2 kidneys, and there are a lot of patients whose kidneys fail, and they end up needing a transplant, and sometimes their family members give them a kidney,
Okay.
which is fine. So you can function completely. You can do well with just 1 kidney, but that kidney has to be functioning well and at 100%.
We have other situations where a person receives kidney and pancreas.
Yes.
Is that because of the diabetic condition?
Exactly.
Affect the kidneys?
Yes, exactly. So there are patients who have type 1 diabetes, or they've had diabetes for a long time, causing up and down fluctuations, and then if their kidneys fail, then they would be a candidate for a deceased donor to give them a pancreas and a kidney simultaneously. So, and those patients then receive those 2 organs and do quite well.
Ladies and gentlemen, again, we're very fortunate to have with us Dr. McKee Conner. Okay, got that right. And we invited her, and she accepted willingly to come to talk with us because I am learning right along with you about nephrology. And I'm wondering, Dr. Conner, is caring for men and women differently, or is it the same?
No, I think it's the same. There's, I suppose, men tend to have more muscle mass. So perhaps, we take a look at that, and their creatinine levels can sometimes tend to be a little bit higher, a little bit in the blood because of that. But usually there's really we treat them exactly the same way, their levels and their values.
Mm-hmm. 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 We mentioned about the eating habits. Living in a healthy environment is so important. And that's when you mentioned about if you don't eat healthy, then that's cause a problem. Now the recommended eating habits. There's your doctor recommends, because a lot of people don't know what
to eat.
what to eat and so forth. Yeah.
Maintaining a weight that's good in terms of your height, and maintaining and eating more fresh vegetables and fruits
Mm-hmm.
is always a good thing.
Mm-hmm.
Watching your salt, especially if you
Okay.
have high blood pressure, to avoid processed foods,
Mm-hmm.
to
Okay.
avoid drinks and alcohol and excessive amounts.
You say drinks, no sodas?
Soda, exactly.
Because it contains the sugar
It does,
content.
and it also contains a lot of other processed products like phosphorus, and those are not good for your kidneys in the long term.
Okay.
And so watching your weight, eating more fruits and vegetables, low salt. If you're diabetic, watching your glucose carefully, that would be, that would maintain your weight.
Some of the results then too, about anemia is one of the results of kidney disease.
That's correct. So kidneys do multiple things, and one of the things kidneys do is help make a hormone that tells the bone marrow to make blood. So now there are multiple other causes of anemia as well. So, not always is it linked with kidney disease, but if you have advanced kidney disease, then it definitely can be linked with, then it can definitely cause anemia. We often have, if we have checked for other causes of anemia and you're anemic because of kidney disease, then there's medications we can give to help have the bone marrow produce more blood.
Mm-hmm.
So, and they are often in the form of an injection. And we do that in our office too, or at the hospitals. We send patients. And that helps them because, anemia can cause, as you know, more fatigue and run down feeling. It can cause breathing problems. You can feel weak. So that's to assist with that.
Now, how prevalent or how common is kidney disease?
So
it seemed like more people are receiving dialysis now than ever before.
And that's true partially because we tend to be our age is longer. We're all doing well. We're living longer, but there's also a lot of diabetes and high blood pressure and obesity that's causing the kidneys to not do well.
Mm-hmm.
And I was looking, and about 10% or so of the U.S. population currently has kidney disease. Now, they may not be all, so that's about 30 million or so.
Okay.
Now, that may not be, all of those patients are not on dialysis, but they have some form of what's called chronic kidney disease, or CKD. And they could be at different stages. Stage 6 is defined as when patients need dialysis. And we have in the U.S. about 450,000 patients on dialysis currently, on one form or the other of dialysis. There's 2 different types of dialysis. So they're on. So that number has been increasing, although, we're starting to see some plateauing, hopefully, because people are getting more aware of, and they're getting diagnosed early. And so a lot can be done to halt the progression. And I think as a society, we're getting more aware of not, avoiding processed foods, avoiding, like you mentioned, sodas and things like that, which cause weight gain, are processed, and all this extra material, phosphorus-containing things.
Mm-hmm.
As a society, we're avoiding tobacco, smoking. There's a lot of initiatives to avoid such things. All of those are linked with, worsening kidney disease. I think we're becoming more aware.
Mm-hmm.
So
Mm-hmm.
as we are becoming more aware and learning, we're doing better in slowing down the progression
Okay.
and hopefully avoiding, dialysis or transplant in the future.
That means family support is so important then for a person that has kidney disease and which leads to dialysis.
Absolutely. Absolutely. Family, our families families have to be so involved in the care of the patient. There's a lot of dialysis is not easy. When patients do have to do dialysis, it's very difficult. Often they have to go to, if they're doing the hemodialysis, which is blood-based, they have to go to a dialysis center 3 times a week.
Okay.
Sometimes there can be transportation involved in that, and the families have to take the patient. Patients can often be weak after that, and they need help with their daily activities or cooking or meals and support there. Sometimes patients do home dialysis. They can do home hemodialysis, or they can do peritoneal dialysis, which is done through the peritoneum or the stomach, or the abdominal cavity, I should rephrase, and that can need assistance at home. So it's great to have families be involved with the patients. We have started a support group here in Lake County as well, which is which meets every couple of months for dialysis patients, for kidney failure patients, or anybody who has chronic kidney disease, and for their families for education, for supporting them.
So the lifestyle of the family oftentimes have to change, right? I know there's people take early retirements to take care of their loved ones.
Yes, and diet may have to, if you have a patient who has some form of kidney disease, and the family has to watch certain types of foods because the patient's potassium is running high, or they have higher blood pressure. So cooking would have to be different for the whole family, or at least for that patient. So there's a lot of education, and we do try to encourage our patients to go have classes on kidney disease. Our patients can have that. We have nurse educators and other educators support our office who can educate you on and teach you about what different types of, what to avoid, diet, kidney levels, stages of kidney disease, and different forms of therapies. And so.
What about insurance, too? I know Blue Cross Blue Shield or Medicare, they do cover the treatments?
Yes, actually, and I'm so sorry, but I'm not completely versed with all of the insurance.
Okay.
But we, at least at our dialysis units, we have our social workers who help assist the patients with their with insurance plans and figuring out things. But dialysis is usually covered by the government.
Okay.
Once you require a form of dialysis, then the Medicare will cover that for you. But there might be certain other rules and restrictions.
What about ultimate goal of Dr. McKee Conner?
Well, that's a tough one. Wow, I think.
Because you're young yet, though, so but you have to have some goal in mind. What's next for you? Is this the ultimate goal, nephrologist?
I'm just so blessed and privileged to be doing what I do because I really do enjoy my job.
Okay.
I love what I do. I love meeting my patients and working with them. It's such a great job because I've found what I really am truly passionate about. Of course, I'm a mom and I have 2 children, so I want to be there for them and my husband. But
they're supportive to you.
They're wonderful, and my ultimate goal is to continue to just, with God's grace, to do my job well, and to take care of my patients well, to stay up to date, so I can perform that job well.
We felt that it's very important for this. This is the first time that Community Focus has reached out in the community to get someone to talk about kidney disease, because the kidney disease is rapidly growing, and so we felt that if we could get a professional to come on and talk about it, maybe they could at least control it, right? And do the things that...
Yes, absolutely. At least if you're aware of what's happening, you can avoid... you can be more proactive. At least you can avoid certain things which may be more toxic to the kidneys. You can be more involved in your care, and if you're aware, you can ask the right questions. You can hopefully then halt the progression.
Now, your relationship with a urologist. Now, you're a nephrologist, but what are you urologist?
So nephrology is a medical specialty of a subset of internal medicine. So I'm an internist.
You're a nephrologist.
Yes.
Urologist and nephrologist.
A urologist is a surgical specialty.
Okay.
So we work with them very closely because a lot of our patients do have prostate-related issues or obstructive problems that can often also then lead to kidney disease. But they're more the surgical specialty, so they will help do a kidney removal or bladder-related issues, and so more surgical.
Okay, to get in contact with you then is through the physician, right? He's the physician. He or she is the one that do the testing and make referrals to you then.
Exactly. Your primary care doctor or your general internist. Yeah.
Great. Ladies and gentlemen, we want to thank you again for taking time from your busy schedule to listen to Community Focus, and Dr. McKee Conner, nephrologist and associates of Northern Illinois, Indiana, and your office is located in Gurnee, Illinois. We didn't mention where your office is located, though.
It's right in Gurnee. My office is there, but we have multiple other locations too. They can welcome to give my office number if you need to, and we're happy to help all patients.
But the referral really is through the physician, through primary doctor.
Usually, yes.
Okay. So we want to encourage you to let you know that early detection of kidney disease is so important. You
Absolutely.
may have thought about it or not, but we hope that you would check the symptoms. And Dr. Conner, you mentioned symptoms should never be ignored, right?
Yes, and symptoms are oftentimes, the symptoms for kidney disease are quite vague. Nausea, vomiting, leg swelling, not feeling well, a generalized malaise or fatigue. And those can be sometimes very nonspecific, but anytime that's happening, you also want to check on how are your kidneys doing.
Mm-hmm. Ladies and gentlemen, we want to thank you for listening to another awareness session on Community Focus. My name is Dr. Wardell Brooks Sr., your host.